Hello, everybody. Hi, guys. Hello, doggy detectives. It's Sarah, aka Frank's mum. With me tonight is the gorgeous Laura Pilbeam. Have I pronounced your name correctly, Laura?
Pilbeam.
Pilbeam. Pilbeam. So we are so excited, doggy detectives, to have Laura here with us. So for today's detective talk, we're going to be talking about animal chiropractors. Laura is, I'll give her a chance to introduce herself in a minute, but Laura is a qualified and professional animal chiropractor, and she has very kindly offered to give us some of her time to come and talk to us today. So just do a quick sound check. Let's everyone say hello to Laura. Give us a few little love hearts. Let us know. And I can see in the comments that people are already getting started. Everybody's joining in. So yeah, Laura, let's get started. Like, tell us a little bit about yourself.
I have been a bit of an animal nut ever since I was little. We've always had dogs around the house. I've owned horses for a while, and I guess I just knew that I was going to go down that road. It was just inevitable. Even when I didn't think it was going to be, my friends were like, it's happening. I was like, why didn't you tell me years ago? So yeah, I just kind of made the leap from human chiropractor to animal chiropractor 4 years ago now, I think it is. And yeah, it's just been so much fun ever since.
And who are you fur mum to?
Pardon?
Who are you a fur mum to?
I've got Joey and Bing, my two little Jack Russells. So Joey was the one who was in the picture because Bing would not sit still long enough. Typical. Reason he's called Bing is because the first thing my mum said when I said I was getting another dog was, "Don't you dare call it Chandler." So Bing it was. So his full name on a Sunday is Miss Chandler Bong, but but yeah, so they're my two live-ins, and then I've got Hope, who's my horse, who I have out at one of the livery yards here as well. So they're a full-time job between them.
Yeah, but it doesn't sound like you ever get a chance to stop. And so, okay, I have to admit, obviously, you and I met a short time ago, and I was absolutely kind of astounded and quite envious of like the amazing work you get to do every single day, and invited you in. But for people who are kind of looking at this and going, okay, I've heard of a human chiropractor, but how would you describe to somebody like myself on the street, what is an animal chiropractor?
Well, it's funny because even chiropractic itself has so many different perceptions. So a lot of people are like, oh, it's about cracking bones and it's about, it hurts and it's torture and blah, blah, blah. But all it really is it's using the joints to help release any tension that might be in and around the nervous system as well as the muscles. So when a joint gets compressed, what can then happen is inflammation will build up around that joint, start to affect the nerves that obviously leave the spine from that area. And that can then create almost like a miscommunication between the spine, the nervous system, and then the muscles or whatever that nerve is then feeding to. So we can see it quite well in humans where we can actually use muscle testing. So I'll get someone to like hold their leg up and I'll be able to push it down with one finger. And I'm going, no, go on, hold it there. And they can't hold it. Find where the restrictions are, adjust there. And then all of a sudden the strength is way up and I can't push their leg down anymore. And it's not that they have a weakness there. It's just that the signals aren't getting to the right places at the right time, if that makes sense. So that's where chiropractic comes in. It's a way of helping the neuromusculoskeletal system to work efficiently, I suppose, if that makes sense.
Oh, wow. And what's the most common things that you see, like in your practice, people coming in? What brings people to your door in the first instance?
The first instance is always pain. It's always pain. People come in with pain, and then what then happens, which is always quite interesting, is they then go, "Oh, I tell you what, I also realised that I've run a PB in a 10K, or I've managed to actually get up and put my socks on." And I've never been able to touch my toes for like 10 years or something. So it tends to be pain that brings people in, but then it's more getting the most out of life after that, if that makes sense. So for the humans especially, but when it comes to like animals, obviously they can't tell you if they're in pain or not. So I see a lot of competition horses, I see a lot of agility dogs, and I see a lot of gun dogs, especially up where I am in Aberdeenshire. We're in the hills all the time, and it's dogs that, they've been performing at such a level, and then all of a sudden they're knocking the jumps down, or they don't want to go on the A-frame, or they're jumping off when they're not meant to, things like that. And they go, oh, maybe there's something going on here. And then that's when I come in.
How does your relationship work with the veterinary industry and like the traditional medicine? Are you seeing more and more vets also making, I'm just hearing what you're saying and digesting it, but can chiropractic, do we say chiropractic? Is that the right term? Because whenever I try to type it, autotype doesn't like it.
I tell you what, it's chiropractic. So it's like chiropractic, but without the E on the end. It's very strange. I don't know who came up with it, but
yeah, I kept trying to, when I was writing you a message going chiropractic, and iPhone did not like that term at all. Yeah. So do you tend to see what's most of the common thing? I'm just thinking about some of the things that I've seen my own friends' dogs go through. So things like trapped nerves, arthritis, those kind of things. Is that also stuff that you in non-agility, non-working dogs that you see?
Oh, absolutely, especially in elderly dogs. It's more about the quality of life. So I'll always remember my first ever dog patient who I just loved dearly. He was this gorgeous all black lab, and his owner knew when I had to come and see him because he'd stopped being able to go up the stairs just because this arthritis in his hips had just gotten so bad. And every time after I'd adjust him, he would then run up the stairs, get his favorite toy, and bring it down to me every single time. Wow. It was so cute.
But that must be extremely rewarding for you
so
as
rewarding.
a chiropractor. Yeah, literally that. So that's how quick we can see something like that. So
yeah, absolutely.
Okay, so really, you go on.
Sorry, no, I was just going to say it just completely depends on how the dog's compensating as well. I mean, if there's a lot of muscle tightness to get through, then obviously it's not quite that quick. But because he was seen quite regularly and his owner knew exactly what signs to look for, it would be that instant. Yeah.
That's fantastic, because I know some people may be looking at this and thinking, obviously, financials. Is it something, I'm just trying to educate, obviously, our dog owners here today. They're here to find out kind of the shortcuts in life to health and happiness of their fur baby. Is it something that people are able to use in insurance, or is it deemed a luxury being able to see a chiropractor?
I think you can use it in most insurance claims, actually, because it kind of falls under chiropractic and physio, particularly under like rehabilitation. So, after a surgery or something like that, then you can absolutely get it covered under the insurance. I think quite a lot of insurance companies are actually coming around to it now, that it's a way to go that doesn't involve, the more invasive things, procedures like steroid injections and like surgery and things like that. It's a way to try first to then kind of prevent having to open everyone up. And
we don't want to do general anesthetics and operations if we don't need
that's
to do
it. It's such a huge undertaking for the dog, so anything we can do.
And what about, so obviously if a dog needs to see a chiropractor, they need to see a professional. We should never try and do things at home if we are not qualified. But what would be some of the top tips that you would say to our fur mum and dads of like things that they could do that doesn't involve manipulating the dog? And I know we're going to get onto some amazing questions later, but those people that are watching this video, what would be your top tips of like things that that people can do now to avoid issues in the future?
So I guess it's the main things, like particularly in young dogs, just not trying to push their exercise too much. So it's a similar thing in humans. So dogs their bones don't fuse until they're about, I think it's between 13, 15 months in some breeds. So it's just making sure that they can fuse correctly before they're then, before they're ready and things like that. Another thing, jumping in small breeds, trying to keep that down to a minimum. Things that I would say that can really help. I might have to borrow. I'm just going to borrow a model. Bless him. Say hi to Joey.
Hi, Joey.
He's not very happy with me. He's been in the car all day. Right, come here, you. So Joey does suffer quite a lot with a bad back, mainly because Bing just barrels into him quite a lot. But also, when he was little, he had a bit of a run-in with a big dog, so he's very nervous around big dogs now. But it's just things like, so I'll try and bring you down a little bit more. So for him, just to be able to even just check and see if there's any areas of tension, I will just come down both sides of the spine and just have a little feel. And I don't know if you can see just there, he just kind of twitches a little bit.
It's almost like, when someone pulls
you just go, oh no, I don't really like that. So I'll just do that. And then what I'll do is you can just do little, I tell my clients quite a lot, particularly in and around the back. So you find the two kind of bony prominent, sorry, Joey, the two kind of bony prominences here, and then just come forward, and the muscles just on either side of the spine there. That's a very tight area for quite a lot of the smaller breeds. So I tend to just say, just pressure that you would put on yourself if you've got a tight muscle, and then just little circles, and you'll find that they actually sit there and they go, I quite like that.
Like a little massage.
Yeah, it is. It's just trying to take some of the tension out. And apart from that, I mean, it's just the usual common sense things, really.
So not too much walking. Do you think that there's any merit in, do you see more dogs that are pavement walked rather than in the woods and on the fields? Is that just an absolute myth? I'm always interested to know, because there's so many different views out there. It's quite difficult sometimes as a fur mother to actually know truth and science versus opinion.
I think I actually find more of a difference in dogs who can't get off the lead or if they pull. I think pulling on the lead, particularly if they don't have a harness on, can create a lot of tension and quite a lot of overdeveloped muscles in and around the shoulders. And if they have got the harness on, then again, because of the way they're pulling, they then end up pinching kind of just in between the shoulder blades a little bit. But when it comes to the pavement, I've not noticed a massive difference. I wouldn't have thought. It's quite hard because, say, up here, we don't really have a lot of pavements. We're in the sticks.
Definitely hard. But you definitely think that they are potentially slightly more beneficial for dogs to be wearing harnesses. In your experience, I'm sure, like, every dog's different, but I'm thinking about the things that people can take away to,
avoid it. Absolutely. I would say if you have a dog that pulls, or if you're in that training stage, a harness is absolutely the way to go, because the amount of tension that goes in and around the neck, and particularly while you're training puppies and things like that, that's such a crucial stage for their necks to develop, that if you then start to put tension there, that can then start to cause issues, which will then down the line lead to early signs of degeneration and things like that. So no, I'm a massive fan of harnesses.
Fantastic. Are you all right if we get to some questions? We have got some people on the line and absolutely desperate to get the questions. So the questions we're going to give to you now, Laura, we're going to go into the generic, because obviously we can't give individual advice based upon the internet. You would have to see somebody in person. But Laura does travel, by the way, guys, all over the UK, and we'll give you the details about how you can get in touch with Laura at the end of this detective talk. So so the questions that we had posed we're in the Frank and Jenny's dog product review group, and it was actually our members that made that actually came back with that, because we love to get our dog
great questions involved. Yeah,
they've been fantastic. So the one question that we've had, which I know is becoming common in some breeds, is cruciate ligament surgery. So is there anything that, if a dog has had cruciate ligament surgery, that can be done as a prevention to pain in the future? This particular dog had some physio, some cold therapy, but even for dogs that haven't had that, what would you recommend, Laura?
So it completely depends on the grade of injury. If it's quite a mild, low grade, what I've noticed quite a lot recently actually is hydrotherapy has been a massive help. So it's definitely worth searching in your area to see if there are any hydrotherapy pools around, because that obviously unloads the joint, allows the ligaments to relax, but it builds the muscles, it builds that scaffolding around to help stabilize the joint a lot more when the ligament's not working at its full. When it comes to the lower grade, the harsher grades, So it's been a long day. One of those words.
No, you know what I mean.
More severe. That's the word I'm looking for.
Yeah, more severe.
Then, unfortunately, I think surgery is kind of the only option for them, just simply because of the way that the cruciate ligaments attach. Yeah, it's such a tough one to call, but that's definitely where I would start to revert back to vets for
advice. And what about if dogs had the cruciate ligament surgery and the owner is worried about, you know, pain in later life? Would they benefit from seeing somebody like yourself regularly, or
chiropractor, physio, any of the above, particularly for scar work? Because the problem with scars is that what you see on the surface is like a tip of the iceberg. So what you see on the surface of the skin is nothing compared to what's going on underneath the skin. And it can turn into, so it can almost turn into like spider's webs a little bit and just start to attach to everything. So just being able to actually work that and loosen that off will just really help with the muscle health as well as the joint to keep moving efficiently.
Okay. And what would you say to if a dog has had that problem and has maybe overdone it playing in the garden or doing a bit of walk? Are there any kind of small takeaways that you could recommend in advance of them seeking the right advice and support?
I'd say try and get the inflammation down as quickly as possible if it's been tweaked. Cold therapy, absolutely. Try and rest them, but don't. I wouldn't say cage, because if they're in quite a small environment, then it's going to seize up a little bit too much.
Okay.
So try and rest them, say lock them in the kitchen or something, just so they've got a little area to walk around and just keep the joints moving and keep things moving. But not so much that it completely seizes up on them.
Well, that's really interesting, because all the advice I have seen previously across, you know, various sources always recommends the crate. So that's definitely one for me that I'm not going to forget if my fur babies get sick. Okay, thank you so much, Laura, for that question. Also for Joe in our group who posed that question. I hope that got you some answers, my lovely. And also we have got here the question from Nicola's question we have covered about obviously what we can do as fur mum does. I think we did that a little bit earlier. So this question comes from Bruce, and he's actually also part of the team like Frankie Jellies like yourself.
Hi Bruce.
So, and he's really excited because when I told him that you were coming on board, he was like, yes, this is just my thing. And he's also a fellow Scot, so him and our friend Sarah are like, right, when are we going for dinner and drinks? So everyone, those guys are super excited. But Bruce, who you haven't had a chance to meet yet, is actually a trained behaviourist, and he does similar detective
excited to hear that.
Yeah, he wants to understand about any subtle indications of pains that, like, you know, in his work, things like posture and gait changes. His concern is that some are actually going like unnoticed or undiagnosed, and it becoming, you know, a growly, you know, a snappy type behavior when actually it's pain. What advice would you give there?
I totally understand this. Say with Joey, he's very much like a case study for this. So if he does start to tighten up in his back, the way that I know is that he'll go to the other end of the sofa and he won't come near me. He just curls up and that's it. If you just try and go near him, then he'll start to grumble at you. And that's the first sign that I know that he's starting to, well, to begin with, I was like, why don't you love me? Come back. But now I've realized that it's just because he's in pain. It's not that he doesn't love me. Well, I'm sure.
Well, you're just like me. I just go and pick Frank up and he's having a sulk. I'm like, you're not having a choice. Mummy loves you.
It's so true.
So do you actually do you see quite a bit of that then, Laura, where people have actually sought about training behaviourists first, and actually through other things it starts becoming apparent that there's a medical?
Personally, up here, not so much, just simply because where we are in the world, there aren't that many behaviourists up here, so it's hard to actually source one out. So Bruce, I'll be chatting to you. But it is definitely something that I'm coming across more with like the trainers. And it's things like a sudden reluctance to do something that they've always loved to do, or what was the other one? Can't remember what I was going to say now. has been one of those
Grumpy,
days.
reluctant.
Yeah, it's just that sudden change in how they go. So even things like watch them going up and down stairs or watch them getting into the house. Are they doing it in the same way, or all of a sudden are they just taking that little bit of extra time to actually, instead of jump both legs up, to just do one leg at a time and things like that? It's just noticing those little subtle differences in your own dog that could be an indicator of pain.
Okay, so things, just to recap, that's obviously watching them if they are a dog that goes up and down the stairs, the way they get in and out of a car, and then kind of behavioural, are they suddenly getting grumpy? Do you find with Joey that it's more like I don't know, how can I put it? Like, he does get a bit, other than him going away and like, I don't want to say the word moping, but you know what I mean, like
Yeah.
putting some
Oh, he
distance
does.
between. Yeah. Does he ever get growly as well, or do
Yeah.
different dogs? Yeah.
Yeah, and Bing's even started to notice it as well, because he'll try and play and he's just not having any of it. And Bing's now finally learned to just leave it alone and walk away, whereas before he was like, "You should play with me," which caused a few arguments. But yeah, it is. It's just a complete change in who he is as a dog. Almost, it is almost like he's just like, I mean, we feel the same as well, I suppose. You know, if your back's sore, you've had a long day, you come home and then like your husband comes in and goes, "Oh, what's for tea?" And if you're fine, you'd be like, "Oh, I don't know, what's in the fridge, like let's go and have a look." Whereas if you're in pain and you've had a long day, you're like, "I don't bloody know," like, you know, it just starts it just creates that slightly shorter temper than than normal.
And do you ever find, or have you ever experienced that people put it down to behavior because what's the time span? Can it be like minutes or hours? I'm just pre-guessing in my head, because obviously pain is different for every dog. And do you find with Joey that sometimes his episode, so to speak, lasts a few minutes or a few? What kind of ends up pulling him out of like that feeling of pain?
I'm very lucky in that I treat him as soon as I know. So then he has a day off. He just has quite a light day, and then he's absolutely fine. What I tend to find is that a lot of people don't realize just how long the pain could have been going on. Simply because dogs are, you know, they are hunters, they are predators, they've got that fight or flight in them. And I always say, if they feel like they're in pain and they can't choose the flight option, they've only got the fight option left, and that's when you start to get the grumpiness. But that doesn't mean that it's not been bubbling under the surface for a long time. And it's the same with humans. I always say that pain is like a pan of boiling water. You know, it starts at the bottom, and it's only when the bubbles hit the top that the pain starts and the body goes, "Nah, I need to send that pain signal. We can't cope with this anymore." But it will try and compensate and try and regulate it as best as it can until it hits that threshold. So it does tend to have been going on for a lot longer than I think most people realize.
Okay, wow, that's interesting. I know that Bruce will be appreciative of that, and that's definitely something for our members to have a think about. Like, Laura's giving you some absolute gold there in terms of if the dog suddenly becomes grumpy, just look, as Laura said, up the stairs in the house. Are they walking the same way as they would? Are there some other factors that could indicate that actually a different type of help is needed? And what about this? There's one that I'm seeing a little bit more. Now coming about, which might be down to diagnosis, hip dysplasia. Dogs with hip dysplasia, what do you kind of recommend in that instance? Mild hip dysplasia that looks like it's getting more severe.
So it's interesting, actually. I had when I was doing the training course. So the course that I've done, you can either be a vet or a chiropractor to actually train in the veterinary chiropractic course. And one of the instructors, he's been a like a vet chiro. He was a vet and now is a chiropractor as well for a long time in Denmark. And he had a very interesting story about a golden retriever that came in with hip dysplasia, a very mild form, but it was when he was, I think it was diagnosed about 2. So he then saw this dog quite regularly. I think it was like once every 3 to 6 months or something, for I think it was about 8 years or something. So it was then a good 10 years old. And he came back into the clinic and he was just finishing up with another client. And it turned out that the client he was finishing up with was the full brother of the golden retriever. But he'd only just started his treatment. And he said the difference in the dogs, because they had the exact same hip scores, the exact same diagnosis, but the difference in the way that they were able to move was incredible. And I think it's just being able to, if you can catch it early enough and manage it early enough with, with chiropractic, with massage, with physio, if you can keep that joint moving as best as possible, then you can slow it down as best as possible. Wow. If that makes sense. It's a similar thing with like spondylosis in dogs. So spondylosis is basically just like wear and tear that we have, but because they have shear forces instead of compression forces like us, the bone forms underneath. And that's a similar thing. Like if you, even though the bone's like completely fused, if you can still keep that disc moving and still keep the joints above moving, then you've got a much happier dog for a much longer time. Because joints and discs, it's the movement that pushes the nutrition into the fluid. So if you're not getting that movement, then that's not the disc and the joints aren't getting their nutrition, and then they're just going to kind of shrivel up into nothing and stiffen up. So it's movement that actually feeds the spine, so to speak.
Wow, so it's actually not completely resting your dog. It's not actually not allowing them to walk. It's actually just still allowing
gentle movement. Yeah, absolutely. I mean, they do this in hospitals now. With if someone goes in for a cruciate ligament surgery, the next day the physio is moving the leg. Like they don't have to be moving it themselves, but the physio will move the leg just to get that joint moving again, and it just gives you that quicker recovery.
Oh wow! So do you go to animal hospitals and do that then?
I haven't yet, no.
Oh, listen, I've got a very good friend who's the hospital nurse down here, so maybe we'll be seeing if you can go. No, I imagine that must be a huge help. And what about
absolutely,
this is a bit of a sad topic for a lot of us that are kind of like across the different breeds, due to unfortunately bad breeding, and rescue dogs, hemivertebrae problems. So what would be your advice to a dog owner that's seriously concerned about hemivertebrae, the volume of medication, and they just want, obviously everybody, we have to do what we have to do for the health and the welfare of the dog.
Absolutely,
But some owners obviously want to try and incorporate more natural, more kind of, things that they can do. What would your advice be there generally?
Get the dog checked by a physio or a chiropractor and make sure that the rest of the spine is functioning well, because what will happen is, because there's a problem at one area, the rest of the spine will then start to compensate on the way out. So if you can keep that functioning as best as possible, then you're not going to have the same compensation mechanisms build up, through the muscle tightening and all that kind of thing, and affecting the nerves. Obviously, that's got to be done professionally, but also just building the scaffolding up around the spine to try and stabilize it as best as possible, making sure that their muscles are healthy, things like the hydrotherapy, or even just walking them on slightly unsteady ground, because that just really helps to build up what we call their proprioception, which is their joint position sense. So it's a bit like every joint has got all these little nerve endings around both sides, and if that stops moving, they switch off. But if they start to move again, those little nerve endings send a signal to the brain, which tells the brain where that joint is in relation to the one above and below. So that helps to really keep everything stabilized, everything speaking to the brain, and the brain then able to kind of manage that much better.
So that'd be like you saying uneven ground. So things like being in the woods, having to navigate around tree roots.
Absolutely, yeah. You're taking it nice and easy. Cobbles are quite a good one, but just taking it nice and gently over the cobbles, because say running straight over them could cause more damage than it's worth. But yeah, just trying to kind of vary, and even getting them walking over pillows at home, just so that they're really having to actually move themselves and just get everything firing as best as it can be.
So would you recommend, I'm assuming, to do that on lead?
Yes, yeah, absolutely, yeah.
Okay, no, that's absolutely fantastic. Oh wow, Laura, we've been talking for like the last half an hour, and I think I have learned so much. It's been absolutely amazing. I'm just going to pop on and see if we've got some more comments, because we've like flown through all the stuff, and like I absolutely love it, and I kind of don't want you to go, so I'm hoping that we can get...
I'm still around.
No, I know, but I just want to capture some of the comments that are all coming up in this piece. Oh, I know you don't want me to finish either, do you? Who's that, Joey or Bing?
That's a very good question. I think it was Joey.
That's fantastic. I'm just going to jump on and see what other bits we've got in here. And tell people a little bit about where they can find you. So your Facebook page is LP Equine Chiropractic, and you do travel?
I do. So for the horses, I tend to stay in the Aberdeenshire area, but stop it, I'm talking. If there's a group of people in an area, then if we can get a few together, then I'm more than happy to pop down. I'll do weekends in different places. I did a weekend down in Wales a few months ago, things like that. So yeah, if there's a group of people, I'm more than happy to travel about, because us chiropractors are far and few between.
Yeah. So are you seeing more human chiropractors move over to the animal chiropractor industry? Is it you quite small? You said there's not many of you, but is it a really small community? Is it growing? Is it?
Yeah. So there's only 5 of us in Scotland. I'm not sure about down south, but there's not been that many. So a couple of years ago, the Bournemouth University, which has one of the chiropractic degrees, has started doing the animal chiropractic course as well, which is really helping to actually get more people into it. But before that, you had to go to Germany for it. So yeah, there's not many of us around. It's growing, but yeah, it's slow.
Oh, that's fantastic. Well, we'll definitely have to see if we can get some sort of event for our fur mum and dads together, and we'll keep our group members posted. But no, thank you so much, Laura. That's been absolutely amazing. If anybody would like to contact Laura about... No, we've loved having you. I'm seeing all the comments coming through, and I know there's going to be a huge amount of people watching this on replay. If you do watch this on replay, please let us know with the word #replay. We've had a wonderful time with Laura, and we really appreciate her giving us her time. If you do want to contact Laura, she is at LP Equine Chiropractic on Facebook. Is that also your Instagram?
Yes, LP Equine Chiro. So I focus more on the horses, but I can't say no to dogs.
Absolutely, and there's only a few of you in the UK, so the Frankie Jellies members want to get themselves get you all on our reserve. So thank you so much for being with me. And if we've got any questions, please pop Laura a Facebook message, or arrange obviously a consult, and we'll see if we can pop and get you guys an event. So I'm going to say bye for now, and I will catch you all a bit later, friends. Thank you so much. Speak to you later.
Thank you.
Take care. All bye.